Hi, I'm Dr. Keith Ryan, a chiropractor in Tulsa, Oklahoma. I wanted to talk to you about treatment of sprained ankles. Now, sprained ankles is kind of a big subject because there's a lot of different things that can happen to your ankle, and there's varying degrees of sprain. There's the minor sprain, where you just sort of rolled that ankle really quickly, just kind of flopped it over and came back, and you felt it, and it hurts, and you may get some bruising and a little swelling, but it's not, terrifically terrible, as opposed to the one where you completely roll over and fall. Your foot pretty much stays flat on the ground, and your ankle goes all the way over, and you've really messed that ankle up, and it hurts. You haven't broke anything, but your ankle's pretty much a balloon and black and blue, and you're having a really difficult time walking around on it. Well, what do you do with the two different ones? Well, and you're going to have different treatment depending on which. If you've got the slight sprain, then that's a fairly easy one. Me as a chiropractor, I align the joint either with my hands or with an instrument, depending on how bad it is, so that we get the joints functioning the way they're supposed to be. And then I'll tape up your ankle so that we keep the swelling out of it. And then we'll have you do the things, rest, ice, elevate to get it better. And we can keep you moving. Sometimes we can take those ankles, and within a few days, you can be back to running or jogging and doing the things you want to do. I mean, it can be a really quick recovery on those. If you got the really bad one, then that may be a different thing. Then we may treat you with a number of therapies to bring down inflammation, align it with an instrument, maybe even put you in a boot just to keep it immobile, because you can't really walk well on it, but with the boot you'll be able to walk a little bit better there. Sometimes we can just tape those too, and they'll do really well across that. So there's really a lot of treatment. If it's not broken, a chiropractor could really come back, because the thing that we can do different than any other person is we can realign the joint. And I tell you, realigning that joint allows that joint to function the way it's supposed to be. The inflammation just really runs out of it just so much quicker than if you leave that joint out of place and then you try to, even icing it and that. It just doesn't get as better as quicker without the joint realigned. So either way, chiropractor is a good option on both of them, and it'll be treated a little differently depending on the severity of your ankle sprain. Thanks so much.